morning, student. Today's topic is on Human Organ Transplant Act or Hota and also Advanced Medical Directive AMD in Singapore. Let's look at Human Organ Transplant Act first. Now, we know that there are people who are living longer now, alright, and thus they may suffer from a lot of end organ diseases like kidney failure, liver failure, heart failure, and so on. And these people needs organ transplant. So where do you get the organ transplant? Of course, you can actually ask from donation, alright, especially those people who actually sign up for volunteer donation, and if they die of certain accident and so on, they can donate the organ. However, these are very rare because not many people actually bothers to sign up and to donate their organs. So because of this, alright, the government also looks at other kind of organs, like can they use it from prisoners who are sentenced to death, right? Or splitting of organs, maybe one liver can be split to donate to a few people, right? And of course, they also look at living donors, instead of getting organs from people who died, some of it like kidney and liver, you may actually get liver donors. So these are some of the steps to increase the number of organ donation. There are 6 types of living donors, alright. These are genetically related. That means that they'll probably be brothers, parents, child, and so on, because there are some common genes, and these are good because there will be lesser risk of rejection. They are emotionally related. For example, husband and wife. That means that they don't share the same blood group, they don't share the same genes, but they are married to that. They may be good Samaritan, who people say who don't know, who are not related. These people will say that, but I want to donate to help these people. There are vendors, people who sell the organs. There are organs exchangers, which is like, I donate this organ to you, you donate another type of organ for me because I need the other organ. So these are organ exchanger, right? So now, in Singapore, the Human Organ Transplant Act first came as early as 1987, and the aim of it to remove the organs from bodies of persons who have died as a result of accident or for transplantation. Alright, so this actually started very early on, and they actually provides the government to take the organs, from those people who have accident. And when that occurs, when a person has died and there has been occurred irreversible cessation of all functions of the brain of the person, right? So if you want to do a human organ transplant, right, you need to define that the person has died. And one way is, of course, you get a group of independent doctors to certify this person has been brain dead. Now, there are also some exemptions from the Human Organ Transplant Act at the time. Alright, some of these could be there's a rejection. Some people who actually rejected about this already and say that I would not want to donate the organ when I die. Alright, and at the time, all Singaporeans and permanent residents are informed of this law, right, when they reach about 21 years old. So you have a right to opt out. So this is an opt-out system that, if you don't opt out, you are automatically in this Human Organ Transplant Act. But if you don't want to donate the organ, you actually can opt out, right? But who are also not covered in this Human Organ Transplant Act? People who are not Singaporean citizens, like foreigners, right, and so on. And there are also people who are below 21 years old, alright, unless the parents has consented it, and also people who are above 60 years old. The reason is because people who are above 60 years old, the organ may not be suitable for transplantation, right? And the government also says that no authority given for remove organ from body of any deceased patient whom the designated officer has reason to believe was of unsound mind. So that means that if a person is mentally retarded, the law also doesn't allow this person to donate the organ. Now, later on, there is a further expansion of Human Organ Transplant Act, right? Before we look at the expansion, we need to look at why is there a need for the Human Organ Transplant Act, right? We mentioned that, this was needed because not many people actually volunteer to donate. So by having the Human Organ Transplant Act, you actually force people to donate their organ, right? Then in January 2004, the Human Organ Transplant Act was amended further on. And what does this cover now? it extends beyond kidney. The earlier 1987 is only for kidney donation. Now it also covers liver, heart, and cornea. It also extends beyond death due to accidents to all causes of death. So previously the act only covers somebody who died from accident. Now if die for all causes of death, the doctors actually consider whether the organs are suitable. For example, sometimes if the person may die infectious disease, SARS and so on, then of course it's not suitable for transplantation. But if a person may, let's say, die from cancer, and if the cancer doesn't affect the organ, the doctor may consider taking that patient's organ for donation. And it also extends Hota beyond cadaveric donation to living donation. Right, so that's about the Human Organ Transplant Act. Now let's look at the second part of the talk, which is on Advanced Medical Directive. What is an Advanced Medical Directive? It is actually a legal document which you sign in advance to inform the doctor who is treating you that in the event that you are unconscious, you do not want special life-sustaining treatment to prolong your life. So this is a voluntary decision. Alright. Now if you don't sign on that, for example, if you are met with accident and you're in coma, then the hospitals and the doctors are obliged to keep you on the life-saving machine until you die. So sometimes you may not die because you're on this machine, and you may live for about 5 years, 10 years, and that incur a lot of medical costs for your family members, and also incur a lot of suffering because you are actually not going to live anyway. So by signing on this AMD, you're actually telling the doctor that if you are in terminal condition, please do not try to keep you alive longer. Now, that is because now with the modern technology, in theory, you actually can keep people alive for a long period of time, even though the person is brain dead. This could be through those machines like ventilator and also heart machine to make sure that the heart doesn't stop, right? So this law was passed in 1996, right, to allow the Singaporeans to actually volunteer to not resuscitate themselves if they are on severely ill. Now, before we look at the AMD, we also need to look at some of the issues, the ethical issues around it. If somebody wants to say that, if I'm terminally ill, please do not keep me alive further, we need to know how do you define terminally ill? So this should be done by a trained doctors who are independent. It cannot be by your own group of treatment doctor, because your own group of the treating doctor may have an ulterior motive in the aspect, right? And AMD also cannot be reversed by other family members. So that means that if you sign on the AMD, and if your family members tell the doctors that no, I want to continue keeping him alive, you can't do that, because it is the patient's wish that he doesn't want to be kept alive. Alright, but to avoid that kind of situation happening later on, it is always advisable for the person who signed on to this AMD to inform his family members about his wishes. Let's look at one discussion question for this Human Organ Transplant Act we talked about earlier on. Let's look at advantages and disadvantages of the opt-in system versus the opt-out system. The opt-in system means that people who opt-in who wants to be volunteer to be a donor. A opt-out system means that everybody automatically becomes a donor unless you refuse to and you sign the opt-out system. So what are the advantages and disadvantages in this group? Thank you.